Almost 7 out of 10 people with HIV live in sub-Saharan Africa. Will climate change affect how fast the virus spreads? HIV treatment, for instance, needs to be taken daily. So what happens with access to treatment during floods? Joining me via Zoom from Tanzania is James Crispin. He is a medical doctor and a researcher specializing in the impact of climate change on infectious diseases. James, thanks so much for joining us today. Do floods make it harder to get your HIV treatment?
Yes, it is very true that floods make it harder for individuals with HIV in our country, Tanzania, and globally to access good treatment care and outcome of the treatment, because floods make to the destruction of the infrastructure and also health facilities in general. So they are not really able to offer good service to people with HIV. But also we have seen floods affect the people who are living with HIV because they lost their CTC card. CTC card is among the follow-up treatment and also the disease progress of the people in their clinic. Some people, they even complain that they've lost their medication because of a flood. But again, we can see floods has destroyed transportation such as road, and it is so hard for some people to assess treatment and preventive care on HIV. But also we have seen floods cause migration of people because some people need to shift to other areas so that they can have less frequency of floods. And it's so sad because some people, they must be forced to travel to other places where they are far from treatment service. So they are lost to follow up and they cannot be tracked.
James, so if people can't get their treatment during floods, then someone with HIV's immune system would of course get weaker, and that would open them up to getting infections that they would normally not get when they're on ARVs. So how does that impact on the spread of diseases such as TB or pneumonia during floods?
People who are having with HIV, they're already having a weakened immune system, and they are more likely to get infections such as TB and pneumonia. But in people where they're staying in areas with flood, they are more likely to get these diseases because flooding have make people to move to the crowded camp, because some of the areas, for example, here in Tanzania, when floods come, some people they must be asked to go to live in the rescue camps. During floods, it destroys the sanitation and also the outbreak of waterborne diseases and other opportunistic infections.
Do people have more risky behavior, sexual behavior during floods that will make it easier to get HIV?
Yeah, it is so generalized, but I believe yes, during flood area, people they are more likely to get risky sexual behaviors, and they'll put them at risk to acquire HIV. I can talk of a vivid example. We've seen now a growing burden where people they do transactional sex for food and money. So during floods, there are people they already have economic and social stressors where they use transactional sex for living. So some people they are forced to having transactional sex for money and food, of which this predisposes them to more likely to get HIV.
You've spoken about social and economic stresses during floods now. So what's the impact on mental health then?
These challenges really affect the mental health because people they get depression, they get anxiety, and particularly for people who are already having also HIV, mental health is very important because they need to have good adherence to their medication. So mental health is very essential because if someone is not mental okay, will not be able to adhere for medication and good follow-up to their clinic. So there are some of the reported cases of missed visits in the clinics, and some people they're not really having good adherence to their medication, and which will affect the outcome of the disease such as HIV.
James Crispin, thanks very much for your time today. So there you have it. Looking after our climate is also looking after our health. That's our Health Beat. Stay well.